Maybe this sounds familiar. Your hands start to shake, your heart races, and even though you know you studied, the second that exam starts, your brain goes completely blank. Test anxiety is incredibly common in nursing school, and it can mess with your confidence, your grades, and your well-being. That's where Rula comes in, R-U-L-A. Rula is a mental health care platform that connects you with licensed therapists who actually take your insurance. They accept over 100 insurance plans, and sessions can cost as little as $15. Even better, you can get matched with a therapist based on your needs and goals, with availability sometimes as soon as tomorrow. There are no wait lists, no confusing paperwork, just real, affordable care designed to help you feel more in control before, during, and even after that next exam. Thousands of people are already using Rula to get affordable, high-quality therapy that's actually covered by insurance. Visit rula.com/nursemo to get started. After you sign up, you'll be asked how you heard about them. Please support the show and let them know I sent you. That's rula.com/nursemo. You deserve mental health care that works with you, not against your budget. Hello there, I'm Nurse Mo, and welcome to Mo's Monday Minute, a shorty episode of the Straight A Nursing podcast where I share a quick tip you can start using to improve your practice or habits right away. For more in-depth topics, check out the episodes I release on Thursdays. So have you noticed that there are different beta blockers out there? Yes, you probably have. Beta blockers like labetalol and metoprolol sound very, very similar, and, you might think, they're interchangeable. Whether my patient's on labetalol or metoprolol, probably no big deal, right? Actually, no, they're actually different, and I'm going to explain the difference to you here today in this shorty episode. Yes, labetalol and metoprolol are both beta blockers, but each one is chosen based on some very important criteria. And oftentimes, or most of the time, this has to do with the patient's respiratory status. So you might be thinking, what in the world does a respiratory status have to do with a cardiac medication? So let's talk about this. There are essentially two types of beta blockers, cardioselective and non-cardioselective. Now, both are going to do beta blocker things, right? Decrease heart rate, cause blood pressure to go down. But the cardioselective type of beta blocker mainly exerts its influence on beta-1 receptors. And where are beta-1 receptors? In the heart. That's why we say it's cardioselective. It's mostly going to be acting on the heart. And examples of cardioselective beta blockers are metoprolol, atenolol, and esmolol. Of those, metoprolol probably the most common. Now, labetalol, on the other hand, is a non-cardioselective beta blocker. It's going to target beta-1 receptors of the heart, but also beta-2 receptors of the lungs. And this means that a medication like labetalol can cause bronchospasm or bronchoconstriction in the lungs, which is why you would not want to give a non-cardioselective beta blocker like labetalol to a patient with asthma or COPD. Other beta blockers of this type include carvedilol, propranolol, and timolol. Timolol is actually mostly used as a topical medication for glaucoma. So if you are discussing with an MD that your patient, maybe you're discussing adding a beta blocker to their regimen, and the patient has a restrictive airway disease like asthma or COPD, make sure you mention that so that the physician knows and they don't prescribe labetalol, because metoprolol would be a better choice. So I hope this helped you understand the difference between cardioselective and non-cardioselective beta blockers. I will see you soon. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com And for more nursing-related content, go to straightanursingstudent.com.
That's the sound of the fully electric Audi Q6 e-tron and the quiet confidence of ultra-smooth handling. The elevated interior reminds you this is more than an EV. This is electric performance redefined.